Parent, your teenage child's body just started shaking. Maybe it is their hand, maybe their legs, maybe it's their whole arm. Either way, you rush them to a doctor. They ran every test, MRI, blood work, all of it, and everything came back normal. Now you're sitting at home wondering what is actually going on with your child. Or your kid has already been diagnosed with the Functional Neurological Disorder or FND, and now it's showing up on top of everything else. Either way, you are in the right place. In this video, I am going to walk you through exactly what functional tremors are, what signs might point toward a functional neurological cause, why kids with the FND often look different from adults when it comes to these symptoms of FND, and the exact questions you can bring to your child's neurologist or pediatrician before and after a diagnosis. For those who are new here, welcome. I am Dr. Lee, a licensed clinical psychologist with a specialty in pediatric health psychology and the founder of Teen FND Academy, a coaching program that helps teens with FND and their families get their life back. I literally created this channel because I kept seeing the same thing over and over again in my work. Parents who were scared, exhausted, and searching for answers that nobody seemed to be giving them. This is exactly why I am here. Let us start with the basics. A tremor is when a part of the body shakes or moves in a way that a person is not doing on purpose. It can happen in hands, arms, legs, heads, even in the voice. This literally could be anywhere. There are so many different kinds of tremors. Some come from conditions like epilepsy or essential tremor, and this is most of the times the parents are so scared about their child when they see their child having these tremors. Others come from what we call a functional cause. So what does functional mean? It literally means the brain and nervous system are not sending signals the right way, not because something is broken or damaged, but because the brain has gotten stuck in this pattern. So think of it like a super simple term, a software glitch, not a hardware problem, even though the brain and body are much more complex than that. But the brain is physically intact, the wiring looks fine on the scan, but the way it is running its program, the way it's communicating with each other has gone off track. This is what a functional tremor literally means. The shaking is real. Your child is not making things up. It is just coming from a different place than most people expect. It's still a real thing. I want to be very clear here. I'm a licensed psychologist, but I'm not a neurologist, okay? So I cannot diagnose your child through this video. Only a trained clinician who has examined your child can do that. What I can do here is to share some signs from the research that clinicians look for when they are trying to figure out whether a tremor might have a functional cause or not. So you can use this as a starting point for a conversation with your child's doctor. So according to a 2020 peer-reviewed systematic review by Bartle and colleagues, so basically they looked at a bunch of other studies around these functional tremors, and that was published in Neurological Research and Practice. One of the key features that clinicians look for, according to their study, is something called the distraction feature. So what this means is that when a person with a functional tremor is asked to focus on a different task, like tapping a rhythm with the other hand or doing a simple math problem in their head, the tremor may change. So it might slow down, speed up, or even stop temporarily. So this does not happen the same way with other types of tremors. And just so you know, this study was not limited to children and adolescents. In fact, most of the studies related to FND are still predominantly around adults, and this included adults as well. So while this information is super relevant, it has not been tested exclusively in pediatric populations. So I am drawing this information and the connecting dots for you. So other signs clinicians may consider include a tremor that changes in speed or intensity depending on the situation, a tremor that gets better when the child is distracted or relaxed, or a tremor that showed up suddenly rather than building slowly over time. So they're looking for these clinical signs that are somewhat inconsistent with what other tremors could be. And based on this research, some of the commonly used tests include, obviously but not limited to, is EMG, which is electromyography. This is the thing that catches their muscle movement, and EEG, which is electroencephalography. Oh my gosh, mouthful. But it's basically the checking the brain activity. Again, these are not the things for you to diagnose at home. They are things to notice, so write down and bring to your child's doctor. So this is just an example and information for you to have a better understanding. So here is something really important that does not get talked about enough. Kids and teens with FND do not always look like adults with FND. And that matters a lot, not only in my opinion, when it comes to getting the right answers.
The Family Guy shares a handful of practical strategies to help you get out of this survival mode, and it shows why our structured approach gets such a strong result. Grab it from the description below. It is free.
A 2025 massive systematic review done by these researchers published in the World Journal of Clinical Pediatrics found that one of the biggest challenges in diagnosing FND in children is what is called symptom variability. What that means in plain language is that kids do not tend to have one single stable symptom that stays the same over time. They often have a mix of symptoms that shift. So your child might have tremors today, fatigue and brain fog next week, and then leg weakness a week after that. Or they might have all of those things and then some at the same time. And maybe they don't have any of those things for weeks, and then suddenly they have all these things coming up months and weeks and later. The research called this a polysymptomatic presentation, which really just means many symptoms happening all at the same time. This is pretty common for this population with kids and adolescents. It is not your child being dramatic or inconsistent, just so you know. It is actually a well-documented pattern in pediatric FND. And I see this all the time. It's like a flavor of the day. It could be just about anything, which makes it very confusing for teens and the parents too. So why does this happen? The nervous system in a developing brain, aka kids, responds differently than in an adult brain. That's just a pure neuroscience. And that means that symptoms can move around in ways that confuse, again, parents and sometimes even confuse doctors. So if you have been told by anyone that your child cannot possibly have FND because their symptoms keep changing, aka, oh, they must be just making things up or faking, or because they have more than one symptom, it cannot be FND, I can tell you right now that is actually the opposite of what the research shows. So why does this happen in the first place? This is the million-dollar question. Why does the brain get stuck in this pattern? I'll tell you why. There's absolutely no single answer because everybody's different, but here is what we know from the science so far, which is a combination of neuroscience and the biopsychosocial model, which I talk about on this channel like 1,000 times. The brain and the body are always in conversation with each other, but your child's nervous system can get overloaded and overwhelmed for various reasons. And over time, the brain can get locked into this state where it keeps sending out the signals even if there is no stress at the time of the symptom happening. So the tremor, the fatigue, pain, all of those symptoms are the nervous system trying to actually protect the body. It is not intentional, it is automatic. How do they get to this place of getting stuck, which again is coming from the place of biopsychosocial model? What that means is FND is caused by a combination of biological, psychological, and social. So it's not just stress, anxiety, and trauma. Can they have those things? Absolutely they can. And in fact, if you're having FND, even though there was no trauma, having the experience of being dismissed or misunderstood can be traumatic for somebody, right? So I'm not saying, oh, it is not a psychological problem. I am saying it is just as much of the biological, psychological, and social problem. The good news is that the brain is not stuck forever. The nervous system can learn, especially for kids. It can change, especially for kids. That is what neuroplasticity literally means. The same brain that learned to produce these symptoms can learn a different way to respond. And I'll say this is not a quick fix. fix. There is no magic solution or potion or that one supplement that's going to change the whole thing. It can be for FND. Most of the time, it takes time and the right kind of support and guidance. But it is possible. I've seen it one too many times in my practice, in my coaching program, elsewhere. So whether your child has a diagnosis yet or not, I want to give you something practical to walk away with today. I am all about being practical. So here are the questions you can bring to your child's neurologist or pediatrician. Either you can write them down or take a screenshot this part of the video. This is for the before the diagnosis. So if your child has not been diagnosed with something called FND or Functional Neurological Disorder, question 1. My child's tests have all come back normal, but the symptoms are real and ongoing. Could this be a Functional Neurological Disorder or FND? Can we rule that in or out? Question number 2. Are there clinical signs during a physical exam that might help point toward or away from a functional cause for this tremor? Question 3. If FND is a possibility, who on your team or who has experience diagnosing and treating it in adolescents specifically? Now, if your child has been already diagnosed with the FND, then these are the 3 questions you can ask. Question number 1. My child's symptoms seem to change a lot. Sometimes tremors, sometimes fatigue, sometimes other things, sometimes non-epileptic seizures. Have you had those cases in others? And are there other signs I should know about to increase or decrease my concern for my child? Question number 2. What does a treatment plan actually look like for a teen with functional tremors? Straight up. Question number 3. What can we do at home to support my child's nervous system reset between appointments? Now, if you can ask all of those questions to your doctor, your child's neurologist, that is a great place to start. FND is one of the most misunderstood conditions in pediatric neurology, and functional tremors are one of the most frightening symptoms for parents to watch, even though it's like one of the most common symptoms of FND. Now, I hope this video gave you a little more language, a little more clarity, and a little more confidence to advocate for your child. And if this helped you, please subscribe. I put out videos every single week to help parents like you understand the neuroscience behind FND and what actually moves the needle toward recovery.
If you want to see how my full program of Teen FND Academy works and how it's helping families resolve FND for real, then watch the video linked in the description box below.
Now, leave a comment below. Has your child's symptom picture changed over time? Because I hear this almost all the time, and I want to hear from you. I read every single comment, and also please share this video with your family who is just as confused or, get this, draw a completely different conclusion on their own and then tell you, oh, this is what it is. You might be the reason they finally get pointed in the right direction. I'll see you in the next video.